Hi, this is Dr. Michelle O'Donoghue reporting from Medscape. If you haven't seen me for a few months, it's because I've been out on maternity leave. And of course, now that I'm back at work, the topic of being a working mother is what's freshest on my mind. I think that there are many different reasons that women work after having a baby. And of course, for some people, it's really a financial decision in order to support their family. But for many of us, we're also quite passionate about our careers and want to continue on those journeys. But I think that there's one shared experience that all working mothers share, and there's no question that many men feel the same. But I think that for women in particular, there is that feeling of guilt of not being able to be at home full time, and yet at the same time struggling to make sure that they're able to meet all work demands. So with that in mind, it got me thinking about what are simple ways that we can help to support working mothers within the workplace to help alleviate some of that stress. And some of the ideas are really very simple, and yet access to some of these options has not remained universal. So specifically, one thing that is immensely important for new working mothers is to have places in order to pump, to do breast pumping while at work. I know that at our hospital, a few years ago, many changes were made in order to improve access. And yet, even though access has been improved, I have found, speaking to many other working mothers, that there is lack of knowledge about what resources are available. So specifically when it comes to breast milk pumping, that there are locations and offices as well as pods that have resources in place for breast pumping to be accessible. We also need to make sure that both in terms of communicating this information to new mothers, that we also make sure that all the established physicians at the hospital are aware that they need to give time to new working mothers in order to break off from rounds or whatever other support they may need in order to have that time allotted to them during the day. Also, other resources are not always well communicated. For instance, childcare backup plans, other childcare resources. These are all easy steps that we can make to help ease the transition for new working mothers when they come back to work. I think that because women in the workplace often want to make sure that when they're back at work after having a baby, that they're not viewed as differently, there is a lack of sense that they should be speaking up to advocate for themselves, to ask about these resources, or a feeling that they shouldn't be, for instance, breaking out of rounds in order to access breast pumping resources during the day. So I think that for those of us who are more senior or established in our careers, need to make sure that especially the junior physicians at our hospitals, both the trainees as well as our junior faculty, are aware of the resources that might be available to them. Again, I think that a lot of hospitals have made improvements in that regard, but it really is not universal. And again, even though the access to resources was available here, I think that by and large, the communication about what is available has not been as clear-cut. So I would encourage all hospitals to really take a step forward in terms of making sure that a plan is in place, really a universal packet that might communicate what resources are available for working mothers could be something that is easy and readily accessed. And I think that would be a tremendous help for helping working mothers get back on their feet when they are trying to reintegrate into the workplace. So I think that working moms, don't want to be viewed as different from the others. Yet at the same time, I think that there has to be acknowledgement that support systems are required in order to help ease that transition to the best of our abilities. So signing off from Medscape, this is Dr. Michelle O'Donoghue.